Okay. Are we ready?
Yep.
Good. Okay. So most of you know who I am. I'm Dr. Firnhaber. And tonight we're going to be talking about lifetime care. What are some of the attitudes and some of the things that we need to know about taking care of ourselves for the rest of our lives? So I want to thank everybody for coming tonight, for taking a half hour out of your lives to learn about this. And my goal is to make Lincoln, and certainly my patients, healthier. Okay, so I want to make the community of Lincoln a healthy community, at least as much as I can. So we're going to talk about 4 aspects to lifetime care. So what is most people's approach to lifetime care? I mean, there's a lot of dogma out there that's founded on a lot of it just stupidity, and we're going to be talking a lot about that tonight. So what is most people's attitude? What are some people's attitudes towards lifetime care? Anybody?
Take a pill and get it fixed.
Yeah, a pill for every ill, right? Yeah, you just, a drug for every bug. You just take a drug and it's good as gold. Does that work? Is it working? Okay. Now, I don't think it is, okay? I mean, the average, if pills heal people, why are they always taking them? Why do they have to be on them forever? And I'm not totally opposed to drugs, but they don't heal, they manage things, okay? But they don't heal. What's another philosophy or another attitude towards lifetime care? Anybody?
I'll eat healthy tomorrow.
Yeah, I'll start tomorrow, manana, right? Yeah. Okay, cheeseburger and fries today, but manana, avocado, right? Okay. So, how about this one? If it doesn't hurt, there must not be a problem. Is that a sound basis for health care? No. Why not? Is it possible to be sick without symptoms?
Yes.
Okay. Can you give me an example?
Colon cancer.
Colon cancer. That's a great example, right? You can walk around with cancer for a long time and not even know it. In fact, by the time it creates a symptom, you got a real problem on your hand, okay? So this is not a basis for sound health care. So if your car doesn't have a C's engine, you don't change the oil. Okay, you wait till the oil light goes on. We change the oil, we take care of our cars because we want them to work better. Okay, but this doesn't mean that people are always willing to pay the price for health, for good health. So anybody in here ever been made fun of for taking care of themselves, exercising regularly, taking supplements? Anybody?
Yeah.
I have.
Yeah.
People have, what are you, some kind of health nut?
Yeah.
Yeah, I am. What are you, a disease nut? I am a health nut. You're right. That's exactly what I am, I remember my wife, they used to give her a hard time when she worked downtown because she ate so healthy. And all the rest of the people down there were, they're eating, your typical high processed standard American diet. And one of the things she noticed is they were out sick a lot. They're always having to see their doctor, take pharmaceuticals, and yet they made fun of her because she ate healthy. So that may be true with your chiropractic care, didn't they fix you yet? Are you still going back? So we're designed from a blueprint that provides a template for vibrant health. And the degree to which we reflect this blueprint is determined by the quality and quantity of care that we give to our bodies. Now, the blueprint is really the spine, okay? That's our blueprint for health. If subluxations are present, your blueprint is altered and vibrant health is diminished, resulting in accelerated aging. And this is one of the things I've noticed over the years is that people who come to me and get chiropractic care on a regular or semi-regular basis, they age slower. And a lot of you here, you've heard me talk about my mother. She's 93 years old. I just went out and saw her a month ago. And she still drives, still gets groceries. She cooked like, I don't know, 4, 5, 6 meals for me when I was out there. She still cleans her house, watches Fox News and gets mad. and she still is a pretty vibrant life, but she's taken care of herself for a long time, and she gets adjusted at least once a week, sometimes twice. So you don't exercise today so you have a heart attack tomorrow. I mean, exercise enhances our entire life. It makes our body work more efficiently. So we don't read so we don't get a headache tomorrow. We read because it enhances the way our brains function. It keeps our brains sharp. So lifetime care is a discussion a lot of people won't engage in. And I mean, I know a lot of people, you talk to them about lifetime care or taking care of themselves, they get this glazed look over their eyes. It takes a certain level of evolved thinking to realize that you don't just respond to your health when there's an emergency, okay, when there's a crisis. So we don't wait till our houses are seized before we respond to the IRS, okay? Or we don't wait till we take care of our heart before we have a heart attack. So if we look at important point number 2, lifetime care is not an outcome, but a never-ending process we must be consistently engaged in. So we never stop with lifetime care. So let's look at some of the things. When are we going to be done exercising? Like when we're 50? 45, I'm done, I'm not brushing my teeth anymore. I'm not exercising anymore. I'm not going to pay any more attention to my family. I'm done, okay? No. When are we going to be done eating the right food, brushing our teeth, praying, loving our family? It's an ongoing, it's something we're never done with. And so anything that applies to the virtue of existence is a process that we're always working on. Now, some people, when they start chiropractic care, they hear stories you have to go for the rest of your life, and you don't have to. But if you're like me and a lot of my patients, you find out that you feel better, and you have a lot more vitality, and you get sick less often if you get adjusted, okay? So you don't have to go for the rest of your life. You want to because you want to be healthy. So let's talk about, this is a patient, I call her Sally. And she was about 22, she was in a car accident. And I sort of saw her every now and then, but not real regularly. So she's in this car accident, and she came to see me regularly for a while, okay? And at the end of 3 months, she says, "Can I ask you a question?" I said, "Yeah, sure." She said, one of the things I noticed before this car accident is I had really irregular, painful periods. And she said, since I've been coming to you regularly, all of that's disappeared. Is there any kind of connection between the two? Is that a coincidence, or is there a connection between the two? I said, yeah, I think there is a connection, okay? We got your body functioning right, we got your nervous system functioning right, and so the rest of your hormonal issues in your body are starting to clear up. So there's a definite connection there. And a lot of people, they don't understand that. They can't comprehend the fact that our nervous system in our body controls everything. And when you fix that, you can get a whole lot of other things corrected without all the pharmaceuticals and without all of that. And she gets that now. So important point number 3, caring for your health is something that you do at certain moments and something that you don't do at other moments. So my argument with this is that we render care for ourselves at every moment. So how does that work? So let's look at Hans Selye. He was the one who developed this triad of stress. He's the one that came up with the word stress and all the things that go along with stress, okay? And he found that stressful thoughts, emotional upsets, make cancer grow faster. Now, that was pretty radical back in the 40s when he was coming up with his theories, and he was he was really ridiculed and laughed at for saying that. But now, today, it's accepted that the thoughts we keep can accelerate the pace at which disease takes itself over. So, how many of you would agree with that, that stressful, negative thoughts accelerate health issues? Yeah, everybody would agree. Most people would by now. Here's another individual. Reike Hamer was a German physician, and in the early 1980s, his son was murdered, and about 6 months later, he developed testicular cancer. He's going, now wait a minute, I was really healthy before this happened. And so he started doing some investigating, and he found that every one of his patients who developed cancer had some sort of unhealed emotional trauma sometime in the past. And he was able to categorize these traumas and these emotions in the very specific disease patterns. Now, he was also laughed at. In fact, in Germany, his license was taken away, and because he found something that was completely out of alignment with your traditional medical thinking. And what he found was that, like lung disease or lung cancer is due to unhealed grief or sorrow. Stomach and small intestine cancer was due to indigestible anger. Liver, starvation of love. Now here's a few other ones he had. And he had them all categorized. If you had a kidney issue, like kidney cancer, that was due to abandonment. Large intestine, deceit, betrayal, or nasty inheritance issues. Pancreatic cancer, family issues, unresolved family issues. And I could go through this whole list, but he came up and he found that for every cancer that he found, there was a spot in the brain that you could find on an MRI that correlated with the cancer and the organ. And so he started this whole society called German New Medicine. And I use some of his stuff in my office. I don't do a tremendous amount of emotional work, but what he found was that emotions play a huge part in disease and in chronic disease. So we render care to ourselves by lots of things. Number one, the beverages we choose to drink, whether or not we choose to exercise, the foods we choose to eat, how much we chew our food. That's one I fall down on pretty hard, okay? I get reminded of that a lot. Whether we smoke cigarettes, whether we drink to extreme, whether we have limited sugar or too much sugar. So I'm going to ask the sugar question. I always have a question about sugar. So what's one of the number one problems in the body that sugar produces? Inflammation? That's exactly right. Inflammation. So if you have inflammation in your body, you're inflamed, you need a lot of sugar, you need to lower your sugar intake. Okay? So what does inflammation do that's bad? Nobody knows.
Hurts.
Okay, it can. Okay? But you can have silent inflammation and not even know it. So inflammation keeps your body from healing. It's a healing process. We need it. But when it's out of control and when it's something that shouldn't be there, inflammation will keep your body from healing. And I'll tell you this, if you ever have to have surgery or you know somebody that has to have surgery, one of the best things they can do for themselves is get an inflammation marker before surgery. If that marker is high, their chances of having problems after that surgery or having a really slow healing process are very high. So lower amounts of inflammation allow your body to heal faster. And when we eat a lot of sugar, when we eat the standard American diet, a lot of the processed oils, that causes elevated levels of inflammation. And over time, that causes disease or your inability to heal quickly when you do get sick. Okay? So whether or not we consume artificial sweeteners, they damage the central nervous system. We know that. That's an absolute fact. So are we rendering care to our body every living, breathing second? What about when we sleep? Are we rendering care to our body when we sleep?
Yes.
Okay, how?
Well, part of the time you're detoxing, you're cleansing, and the cells are renewing themselves, regenerating.
Yeah, so your brain cleanses itself when we sleep, okay? So if you don't get enough sleep, what happens to your brain?
Wears out.
Doesn't work very well, right? So what about, here's another one. How about if you go to bed angry and those thoughts just percolate in your head all night long? Do you think that's helpful? No, that could create problem, health issues as well, okay? So lifetime care really isn't a choice. The only choice we have is the quality of the care that we're going to engage in or take care of ourselves with. So, so for the friends who say to you, you're still going back to that chiropractor, the question should really be, are you continuing to make greater improvements, or what are you doing to make greater improvements in your health? And do you have anybody have any friends like that ask questions like that to you? Like, you know, what are you doing to stay healthy? You have friends like that? I do. You know, we get together and they go, what are you doing? What kind of exercises are you doing? What are you doing to stay in shape? And those are really good conversations to have, because you can learn a lot from that. So what are the things that we can control? Hey, this is a coronavirus stuff that I had okay, I'm going to skip over that. So important point number 4. My back pain or health issues should be able to be corrected quickly with just a few adjustments. Anybody ever heard that one? I have. I've heard that one. I had a 93-year-old man call my office once and insist that I be able to fix him in 1 or 2 visits. I mean, like, I don't even know where to start with that. You know, I said, I don't want him in my office, okay? Send him somewhere else. Okay, he may have been able to get fixed like that when he was in his 20s and he was eating a healthy diet. That ain't gonna happen now. Okay, so can a lifetime of slips and falls, auto accidents, bad posture, you know, bad diet, stress be corrected quickly? Usually not, okay? In fact, so if you gain, let's say you gain 100 pounds over 10 to 12 years, how long is it going to take you to lose that weight? It's going to take a while. So if you worked real hard to lose that 100 pounds, how long do you think it would take you? About a year? At least a year. Yeah, at least a year, right? So if you damage your spine, you had 30 years of damage to your spine and abuse to your spine, is that going to get well quickly?
No.
No, it's not, okay? And so so this is a really big thing, and it goes back to what you said. You just take a pill and it'll go away. That isn't how it works, okay? So let me ask you this. Is cancer something that happens quickly or slowly over a period of time? Slowly, yeah. So if it happens slowly over time, it may take a lot of changes to get your body to heal, okay? And it may take a lot of time. So what about rendering care to children? So children kind of learn by example. And so what I've noticed with kids is that a lot of kids that I see are not necessarily in pain, but they have other issues. They have frequent colds, frequent sore throats, stomach issues, and things like that, and they get a lot better when you adjust them. So my request to you, as your doctor of chiropractic, is to think about things like your spinal exercises, like your neck traction exercises, okay? Does anybody remember why I give those neck traction exercises? What do they do? What do they do for you?
Increase the blood flow to your brain.
Yeah, you should know that one. Yeah, I gave you the article on that. Yeah, when you bring the curve back into your neck, The blood can get to your brain better. You can think better, think clearer, okay? So what else do they do? What happens when you bring a curve back into your neck? What happens to the discs? Yeah, they don't degenerate as fast. So the discs are healthier, okay? There's one more thing that happens when you bring the curve back into your neck. Anybody remember that? I always tell people this in the report of findings. Nobody remembers. Okay, so we know we have positive research evidence that when you take the curve out of somebody's neck, that it changes the signals from the brain to the body. It changes signals from the body to the brain. So though there's some static going on between here and here. And when you put that curve back into the neck, that changes that static. So now those signals are normal. And we have a really, really good research study that shows that. So those are why I give spinal exercises. Workplace ergonomics is another one. So some people sit too much, so they need to stand up, all right? But here's somebody doing a spinal exercise. That's not the one I tell people to do, but that's one, okay? So here's another thing that I want you to know. If you don't exercise your ligaments properly, they tend to stiffen and harden, okay? That's why it takes time to change the curve in a spine, because if it's been that way for a while, those ligaments are stiff and they're hard, okay? And that's why sometimes when people lay on that Denerol, it hurts, because ligaments are extremely well innervated, and so you're pulling on them and stretching on them, and you can feel that. So when you get adjusted, that really helps keep the ligaments fertile and healthy. So some people, they have a habit of going from health tragedy to health tragedy. Anybody know people like that? Yeah, I do. It's a form of lifetime care. That's another. Now, if that's the case, with anybody in my office, they're going to be really frustrated, because we like health decisions made based on wisdom and not on tragedy to tragedy. So our society is giving us so many confusing messages regarding diets and nutrition. Does anybody ever get confused by that? It's easy, okay? It's real easy to get confused. That's why I do these classes, because I want to help clear up some of that confusion on health, on nutrition, and how we should take care of ourselves. So I'm not necessarily here to treat how you feel. That's important, but I'm here to make sure that your brain is communicating with your spinal column at the greatest capacity so you can be your best. I'm not saying you'll never be in pain again. I'm not saying you'll never have some of the same symptoms you came in with. But if you do, you're going to age slower, you're going to repair better, and those symptoms will be corrected, will be able to be corrected faster, and you're going to heal faster. So, what if you have a medical crisis? And that can happen. So some people have a medical crisis. So my philosophy on that is this, is you need to go to your doctor, you need to say, look, I know that these drugs you're giving me are the best, worst thing that I can do for myself. They may be helping me now, but I'm going to ask you to help me get off these drugs as quickly as possible, because there's side effects associated with those drugs. That would be my conversation that I would have with my physician. How can I get off of these what is the fastest way to get off of these pharmaceuticals? Because they may help me now, but if I stay on them long enough, they're going to create problems in the body. Okay? I want to ask you a quick question. How do pharmaceuticals create side effects? Anybody know? How do they create side effects that they create? Would you agree that pharmaceuticals create side effects?
Yes.
Is there anybody that thinks they don't? Nobody. Okay. So how do they do that? What is it about pharmaceuticals that create side effects? How's that work?
they change how your body's working.
How?
Depends on the drug. I mean, they,
Can you give me one specific example?
no. They mask the problems.
Okay, they do that. Okay. So one way they create side effects is they eat up nutrients fast. So they vitamins and minerals, they utilize those and they eat them up quickly. So they deplete your body of specific vitamins and specific minerals depending on the drug. And I have several books back in my office. I could open them up to you and show you which drugs do deplete which minerals. So when you take a drug for a long period of time, let's look at a statin drug. What are the things that they deplete? Anybody know?
CoQ10.
CoQ10, right? That's right. What's another one? Vitamin D. Okay, vitamin D. All right, and another thing that they do is they deplete hormones. All right, so all your sex hormones are made from cholesterol. So that's the number one thing. Another thing that drugs do is they poison enzymes. Okay, enzymes are really important for body functions. So they poison certain enzymes depending on the drug, and they block receptors on the cells. They block cell receptors. So they poison enzymes, block cell receptors, and they eat up vital nutrients that your body needs to work. And so those are the actions of the drugs that create the side effects. So I'm not saying you should never be on a drug, but you need to try and get off of them if you can as quickly as possible, okay? And even over-the-counter drugs, and I do a whole talk, and some of you see my talk on over-the-counter drugs, create a whole plethora of problems for people if you stay on them too long that can ultimately lead to death, especially if you're older. So if you have a medical crisis, and you have to take some pharmaceuticals, at least try and get off of them as soon as possible. So my question to you is, who do you know that's not well and doesn't know what you know about chiropractic? Who do you know that's suffering, that may be taking pharmaceuticals they don't even need to take, or they're taking things for something that really isn't even a pharmaceutical problem? Who do you know? Let us know, and maybe we can help them. Maybe we can at least check them out and find out, do they have a problem that we can help? If they don't, we'll send them somewhere where they can get help. But at least let them have a chance to find out if they can alleviate some of their suffering without taking pharmaceuticals or without surgery. How many people do you know that have had back surgery that regret it? And I see it all the time in my office. All the time, okay? Surgery that probably shouldn't have been done, okay? And then they pay a price for it later on. And so we want to help those people before that happens. Now, a lot of times we can help them after it happens. It's a lot harder, okay? Much harder. Once you've got used car parts in your spine, it's a lot harder to help those people, okay? But they can be helped. So that's all I have for tonight. Does anybody have any